Hi, I'm Dr. Angela McNelly. Previously, my colleague Zudin Puthacheri explained his research study showing that patients admitted to an intensive care unit, or ICU, can lose as much as 40% of their muscle mass in the first 10 days. Losing leg muscle can affect our mobility, i.e. whether we can walk or run, and if so, how far, or climb stairs. And if we lose a lot, it might take a very long time to get back to normal, whether that's going back to work, visiting friends and family, returning to a favourite hobby, such as golf or bowls, or really simple things like getting out of bed or going to the toilet by ourselves. We visited our ICU survivors 18 months after they had left the unit. Most patients really appreciated the opportunity to retell their story of surviving critical illness. Some were still coming to terms with the unexpected turn of events and having been so ill. We assessed how frail they were, we questioned them about their quality of life, and we asked them to wear a simple electronic device to count daily steps. We also identified those patients with health problems before they became critically ill. Patients coped well with all three assessments, which gave similar results. Compared to those with chronic disease, those who were well before their ICU admission had much greater levels of physical activity 18 months later. Importantly, those who could walk the furthest also had the greatest variation in how much they did do, perhaps taking 7,000 steps one day, but only 3,000 the next. Those whose maximum step count was very low had very little variation. They were really limited in what they could achieve, showing just how disabling critical illness can be. We need to find ways to help ICU patients keep their muscles. Meanwhile, this study suggests that successful rehabilitation of ICU survivors is going to need a personalised approach, depending how well patients were before their ICU admission. Crucially, we think that our findings will enable the first successful rehabilitation trials in ICU survivors to be performed, improving the quality of life and the life opportunities for these people.